Hi, we're going to get this class started by discussing principles of communication. So this is going to be the foundational type of information, and as we proceed forward, we're going to delve into more advanced communication types of topics that are associated with communicating with specific patient groups, patients with disabilities, and interprofessional communication. As medical imaging professionals and radiation therapy professionals, it is our role to provide excellent patient care, and how we can do that is through effective communication. Of course, basic communication is something that we do every day, but it's really easy to kind of get caught up in the minutia of the repetition of the procedures of the day, and essentially not focus on that communication like we should. Effective communication through verbal and nonverbal communication does foster an openness, a rapport. It builds trust. And really, that type of approach is vital for the success of patient care and us to be able to provide the high quality services to those patients to increase their overall satisfaction of their experience. Patient satisfaction is something that's under more scrutiny today than it ever has been. So it's something that we really need to retrain ourselves on, and really that can start to focus on active listening skills. But another thing to kind of keep in mind is that patient-centered care is considered to be a partnership. We should be explaining our procedures thoroughly, so not just waiting for the patients to ask us questions, but we should be going above and beyond, kind of providing patients with all of the information that they need to make sound medical decisions. So health literacy is something that applies to that, so making sure that you're communicating effectively to your specific population in a language and in a way that they can actually effectively understand. A lot of this requires additional communication training, but it can just, simple questions and answers certainly are going to help. So you may be just as guilty as essentially this girl, bowing your head saying, "Oh my gosh, he's talking about me, I'm not focusing on my patients like I should." It's just time to improve. It's time to refocus on our patients, just to make sure that we are providing the type of care that's really effective and enhances the quality of services that we provide. Communication itself is very complex. It's dynamic, it's give and take. It's about creating, exchanging, and sharing ideas, thoughts, emotions, information. So there's a lot of moving parts to it, and not all of it is verbal. Nonverbal plays a dramatic role in understanding what we're trying to facilitate. If you just look at this patient here, you can see patient technologists, they're actively engaged. You got the touch of the shoulder by the technologist, the immediate eye contact between the two individuals. At this point, this patient right here feels like he has the technologist's 100% attention. And that's what the point where we need to get to. We need to get back to, it's you and me, and we're nice and patient-centered. I'm here to answer any of your questions. Does that have a dramatic impact on efficiency of a department and throughput, turnaround time? Absolutely. But it also improves the efficiency of patient care. It improves the satisfaction of patient care. And in order for us to continue to run our departments effectively, we have to have sound patient satisfaction results. So, I've touched a little bit on nonverbals there. There's more to come. But the other form of communication involves digital communication. I guess you can say that how I'm communicating right now is digitally. You're not getting those, I'm speaking to you, but you're not getting those nonverbal cues by any means. So, digital communication can happen in multiple forms as it is. So, it can be interactive lectures like we're experiencing here. It can be, written text on a web page. It can be blogs. So there's all kinds of different things that are out there that may be sources of information for those patients. Patients are becoming more and more savvy. They're realizing that these pieces exist out there, so they are expecting us to be more engaged. They're expecting us to answer more of their in-depth questions. So just kind of keep that in mind as you're proceeding forward. The textbook does a really nice job at defining nonverbal communication styles and forms. So starting with paralinguistics, it's not about what you're saying, but it's about how you're saying it. So taking into account the pitch, the stretches, the pause, the size, maybe it was a long day, but those patients realize these types of things. Yes, we need to be on our A game 100% of the time, all day long. So, pay attention to those kind of those negative signals that we're sending out to our patients that we may not even be realizing that we're actually doing. So not only with paralinguistics, but proxemics. So this is just basically perception of personal space. So you look at this picture. There's a lot of good to like about this picture. We saw the last image with the hand on the shoulder. You look at this one. You got the hands on the hands. And we do have to be aware that not everyone is going to be receptive of that. So it is a little bit of a give and take as far as your overall approach. For this patient, I would say that he is very, very satisfied. She's smiling, he's smiling. Again, actively engaged, seemingly to establish some nice solid rapport within this given within this given image. The other thing to note is that they're on each other's level. That's more of something that you're going to do with children type of thing. But it is nice to kind of when one person can't stand, is to get on that level and to really start to communicate in that regard. So movements, gestures, posture, all of those things may impact kind of the perception of what we're actually saying. So, what we say may be spot on, but if we're not making eye contact, if we're not actively engaged, misinterpretations can happen. And, further, the patient's state may impact, whether they actually understand our cues. Sense of humor is one of those things that, is a little bit tough because their emotional factors may not make that a positive action. So lots of things to kind of keep in mind here, but different forms of nonverbal communication I think are important to know at least definitions of. You can see those there. Now, as far as the actual messages that we're sending, they should be sent throughout the imaging exam or therapy treatment. So from pre-exam to post-exam. So basically the time that we take them from the waiting room to the time that we send them along on their way, we need to be communicating. So it's important to instruct them about what needs to be done, how they can help you, answering any questions that they have. So a nice mini Q&A session, talking about follow-up, that type of thing. It's all about answering the questions that they have. And sometimes patients won't just be forthcoming with those questions. You may have to ask them if they have any questions. So one, we have to be forthcoming with information that's not asked, and two, we have to be forthcoming and going about asking the patient if they need anything. But when we provide that information, it can lead to a lot of misunderstanding, which can decrease the effectiveness of the communication process. So we have to make sure that we are speaking to the level and the makeup of the patient. So what that term is here is health literacy. So I do want you to know that definition. It's not something that's discussed within the textbook itself, at least in this first chapter. But I think it's important to understand that everyone has a different capacity to understand basic health information. So that's something that I have kind of set up within the course project, is to think about these types of things and to make sure that we are speaking at a level and in a way that a patient can understand what we're talking about and be able to make informed health decisions based on that. So, how we communicate then would depend on a variety of different factors. Every patient is different, and that's the thing that you obviously, you're all healthcare workers, you understand. So how we communicate with a 13-year-old may not be how we communicate with a 65-year-old. How we communicate with a 4-year-old may not be how we communicate with a 19-year-old. It's different. And those differences are obvious, but we have to just remain aware that what we say matters, and that we have to take into account additional things like educational level, their reading level, cultural histories, their language. Maybe English is a second language to them. Maybe they their English isn't even sound enough that they can comprehend a lot of the major concepts. So there's a lot of moving parts, a lot of variety of factors that like I said, should be taken into account, and each interaction that we make has to be tailored specific for that patient. So I want you to do a little reflection. Do you think this is a problem for you? Do you regularly change your communication styles? And further, how do you really know if what you're saying is effective? Are you getting your point across? Can the patient reiterate the information that you're providing in their own words? So lots of things to think about, but health literacy is of supreme importance. So that's where a lot of our course project is going to focus on. Now, the reason why health literacy is so important is because there's not a lot of shared meaning in some things that we say, our technical jargon, if you would. A lot of disconnects can happen, and these disconnects happen more often than we're aware of. So we have to just remain, knowledgeable of that, and be able to be mindful and make sure that the patient understands what we're actually talking about. It's important to understand that nonverbal communications can also have shared meanings. Now, I have a graphic here, and I apologize if you are Brazilian, but you can see the simple OK sign to us, nonverbal gesture. Hey, your health is A-OK. Well, in Russia that means one thing, in Japan that means another thing, in Brazil it means another thing. So we just have to remain aware, of what we're doing. Thumbs up is another example. Pointing is another example. The way we nod our heads. Yes, is it an upward nod, or is it a downward nod? So there are cross-cultural differences between some gestures. So that's another thing that can influence or decrease the amount of shared meaning that's present in the communication that we're trying to deliver. Now, communication can also be broken down into intra-communication and inter-communication. So intra, like intravenous, means within. So it's within oneself as far as intra-communication goes. So it's that mental conversation that we have with ourselves all day long. The planning, the decision making, the reflection, what we're going to do next. At times, kind of our inside our head conversations can actually affect, our listening skills. We're thinking about the next thing that we have to do. We're thinking about what we're going to make for dinner. We're going to think about, what time we have to pick up the kids from, the babysitter, from the daycare. There's all kinds of different factors that run through our head all day long, and those factors can impair our ability to listen. So, while, intra-communication I think is important, it helps us, with that planning process kind of step by step, and we are actually using intra-communication even when we're going through the exam. We don't tell the patient every step, every action that we're making, but yet we're making those types of things. So that communication, that self-communication does exist. Intercommunication is just the opposite, so it's essentially between persons. So two or more individuals would be involved. There's a sender, there's a receiver. Of course, the sender is the one that provides nonverbals and verbals, and the receiver is the one that interprets them. And whether there's shared meaning with that interpretation is always questionable. And the other thing is, we may have to be sending a nice message, but it may just go in one ear and out the other from the form of just plain not listening, or that misinterpreted meaning or assumptions being made, that type of thing. So when we continue to try to think about, patients' understandings of things, we have to be aware of the impact of mass communication on their understanding. Of course, you have traditional outlets of mass communication, the radio, the TV, the prints, the magazines, the newspapers, that type of thing. And then you have the modern mass communication. Online, mobile communication is huge. Social networking is huge. Of course, email, a little bit more personal. But, there's a lot of information to be had, and our patients pick up that information from a variety of different places. Yes, some of that information is demographically, sounds, geriatrics are less likely to be on social media than, the teenagers, that type of thing. So, where they get their information and their understanding of things comes from a variety of areas, and it may not all be true. But what you need to keep in mind is that people often retain the first piece that they hear, right or wrong. So, there's a lot of false information that's out there, and, it's important for us to educate our patients on different things, educate our patients on radiation, educate our patients on the procedures, in a way that they can understand. So the other thing that, as far as a question goes is that, you can get a bad rap very, very quick as a field because of, one bad thing happening. If you make one error in your CT scan, I mean, that can reap significant damages for your whole entire health system, because the media outlet's going to pick it up. Your patient volume by all means will go down. So, we have to be aware that, mass media contributions can be helpful or they can be harmful, as far as, misunderstanding of information, or, decreasing, patient volume because of, medical mistakes that happen. So just kind of keep that in mind. A lot of information is out there. We have to be aware of that information. We have to do our best to keep it out on a positive spin. The textbook has a really nice section about signs. I encourage you to kind of dig into that section, investigate it, because there's a lot of misinterpretation that can happen. Signs are said to have three parts: the physical sign itself, the object or event that's being signified by that sign, and then the linkage between the two. So when you see this sign, the question is, are you seeing a blue border with a white H? Or are you seeing the actual physical hospital when you see that sign? It's questionable because there is a linkage, and we know what this means. So, we have a mental interpretation of the event that's, to come because of it. Same thing with radiation. We don't need the words to understand that, hey, this is an authorized area. You need to be aware of these types of things. So, keep that in mind, that what we see, which is our very common signals, there are other things out there that may be very uncommon and that can be misinterpreted. So, this is kind of like that physical sign itself, but you can see, here are some different examples of some signs that are out there, a little bit blurry. But, the point is not to see the words, the point is to see the signs. So, there's probably some things on here that you don't know what they mean. You can infer, and you can use your best judgment about what these signs mean, but we may not always have the appropriate understanding of that meaning. So just kind of keep that in mind, is that, even physical signs may be misinterpreted from one person to another person. Kind of that final initial touch point of this first baseline lecture, just to get you thinking about, communication problems that can happen. There's certainly a lot of inhibitors of communication. Yes, health literacy factors can be an inhibitor. Just shared meaning can be an inhibitor. But others may be physical noises, life experiences, use of technical jargon. You and I can speak to each other, with whatever, medical imaging jargon that we want to use, and we can understand each other because we speak the same language. Patients don't speak medical imaging. Medical imaging is a language, just like, medicine is its own language. Every subset of a field is its own language. So we can't always use that technical jargon to assume that there's going to be some meaning present. Cognitive meaning is a kind of a cool little term. If you think about the dictionary itself, it's why, there are at times multiple meanings of that same word. The textbook gives a great example of the use of exposure. So for us, we think we'll say X-ray exposure means to produce an X-ray beam, to produce that final radiographic image. Well, for the public, the term exposure may mean subjecting someone to germs. So just being aware that words may not always mean the same thing is something something to keep in mind, because we know what we know, but patients do not. So, and it's important to make sure that we're speaking at a level that the patients are going to understand, because it all goes back and it ties back to the important aspect of patient satisfaction. So that's the first chapter. Hope you've enjoyed.